If you're over 70, you've earned the right to be choosy. Choosy with your time, your energy, and your medical test. Some checkups save lives. Others, they create fear, trigger cascades of follow-ups, and leave you worse than when you walked in. Today we're breaking down 5 checkups to question after 70, what they are, why they can backfire, and the smarter moves that protect your health without putting you on the medical merry-go-round. This is educational, not medical advice. Bring what resonates to your clinician and make a plan that fits you. The ground rule before we start. Ask one simple question for any test. What happens next if it's positive, and if it's negative? If either answer is more tests without a clear benefit, hit pause. You're not refusing care, you're choosing wisely. Checkup number 5 to question. Reflex bone density scans, DEXA, that automatically push drugs. A DEXA scan measures bone density. Useful? Yes, especially to identify high fracture risk. But after 70, a lot of people get scanned, see osteopenia, panic, and are hurried onto medication without anyone asking the most important question. What's my actual fracture risk, and do I even need a drug? Because here's the quiet truth. Age itself lowers the number on the report, but the outcome you care about is fractures, not a score. If you've never fallen, you're strong on your feet, your vitamin D is corrected, your protein intake is decent, and your strength training with balance work, your fracture risk may be far lower than the label, osteopenia, makes it feel. Smarter move. Build from the ground up, vitamin D repletion, adequate protein, calcium from food, resistance plus balance training, vision/footwear review, and home hazard fixes. Medications can help when true fracture risk is high, but they're not automatic just because a number dipped. Ask for a FRAX-based risk discussion, fall risk screen, and a lifestyle plan first. Screening itself remains standard for older women. What we're questioning is the reflex drug-first pathway without a risk conversati. Checkup number 4 to question. Brain MRI for mild, slow memory complaints without red flags. You misplace keys more, stumble on a name, take longer with the remote. That's scary. A reflex MRI seems reassuring, let's just look. But for many older adults with mild, gradual memory concerns, scans mainly show age-typical changes that don't explain anything, and often trigger cascades. Repeat scans, spinal taps, or just months of anxiety over vague phrases like nonspecific white matter changes. When imaging helps, red flags, rapid change, focal neurologic signs, head trauma, seizures, cancer history, immunosuppression. Absent those, start where the answers live. History from you and a partner, cognitive screening, sleep review, meds, B12, thyroid, depression, hearing, and vision. If imaging is needed, it's targeted to a question, not a fishing trip. Smarter move. Do a structured cognitive screen first and fix the masqueraders. Sleep apnea, low B12, thyroid issues, meds that cloud thinking, mood disorders, uncontrolled BP/sugar, hearing loss. Scan for cause, not comfort. Checkup number 3 to question. Cardiac stress tests in people with no clear heart symptoms. Treadmill or drug-induced stress tests can be life-saving when symptoms point to heart disease, exertional chest pain, breathlessness that matches effort, clear drop in exercise tolerance. But in asymptomatic older adults, these tests commonly flag problems that aren't problems, which then snowball into angiograms, stents, bed rest, contrast exposure, and hospital stays, with no improvement in survival for people who didn't have true angina to begin with. Symptom-driven testing helps, screening does not. If you don't have clear warning signs, focus on blood pressure, lipids, A1C, walking program, sleep, and meds adherence. If risk needs refinement, a clinician may choose other tools. But blanket stress testing in the well, especially over 70, buys a lot of false alarms. Smarter move. If you do have symptoms, get targeted evaluation rapidly. If you don't, invest effort where it pays off every time. Fitness, BP, LDL, glucose, weight, neutral strength. Checkup number 2 to question. Routine colonoscopy beyond the window, when a stool test would do. Colon cancer screening saves lives. But the window matters. For many people, routine screening is best up to 75. After that, decisions should be individualized, based on overall health, prior results, and preferences. Because the prep, sedation, and procedural risks creep up with age, while benefit shrinks, especially if you've had normal scopes already. If you're 76 to 85, it's a case-by-case decision. If you're healthy and value maximal detection, There are non-invasive stool tests like FIT you can do at home that carry zero procedural risk and still catch most concerning cases. And you only scope if the test is positive. Past 85, routine screening is generally stopped. Smarter move. Ask, what's my prior screening history? What's my life expectancy and surgical risk? Would a FIT test be a safer first step now? Use the least invasive test that fits your risk and values. If you have new symptoms, bleeding, iron deficiency, anemia, unexplained weight loss, bowel habit changes, diagnostic colonoscopy is different. Don't delay that discussion. Checkup number 1 to avoid: executive whole-body screening scans, CT/MRI, when you feel fine. They're sold like a crystal ball. We'll scan you head to toe and catch cancer early. The reality? No evidence of life-saving benefit for asymptomatic people, plus a truckload of harm. Radiation exposure for CT, incidental nodules that are normal for age but trigger cascades, repeat scans, biopsies, sometimes complications, and months of anxiety you didn't need. Professional groups have said it bluntly for years. Don't do total body screening scans if you have no symptoms and no high-risk indication. If something feels off, persistent pain, unexplained weight loss, blood where it shouldn't be, then targeted imaging makes sense. But scanning everything just to check is like looking for treasure with a landmine detector. Smarter move. Invest your time in evidence-based screenings appropriate for your age and risk, and in the daily habits that prevent the diseases scanners can't cure. Movement, sleep, blood pressure control, smoking cessation, and olive oil forward plate, and relationships that keep you engaged. The cascade trap. How good people end up in bad pathways. Here's the pattern. A test finds a maybe. The maybe demands a more specific test. The new test finds a tiny abnormality that most of us carry around forever without harm. But now it has a name. So we poke it, biopsy it, or operate, exposing you to risks that didn't exist yesterday. That's the cascade. The fix isn't to fear tests. It's to choose tests that truly change decisions and avoid the ones that manufacture patients out of well people. What to do instead? Your wise testing playbook. 1. Decide by goals, not fear. What outcome matters? Longer life, fewer hospital days, less worry. If a test doesn't move one of those needles, skip it. 2. Start with low-risk first steps. For colon cancer after 75, FIT before scope. For memory, cognitive screen and labs before MRI. For heart disease without symptoms, risk factor control before stress tests. 3. Know your baselines. Keep a home BP log, weight, sleep hours, and walking minutes. Trends tell truth. 4. Audit your meds. Sedating antihistamines, certain bladder meds, some sleep and anxiety meds can fog thinking and raise fall risk. Review annually. 5. Train for the floor you live on. Strength plus balance beat most pills for fall prevention. 10 minutes after meals, 2 short strength sessions weekly. 6. Ask about harms. Radiation dose, contrast risk, bleeding risk, sedation effects. If harms are real and benefits are speculative, pivot. When tests absolutely matter, don't delay. New chest pain with exertion, pressure in the chest, jaw, or arm, same-day evaluation. Blood in stool or urine, black stools, or iron deficiency anemia. Talk now. Rapid cognitive or personality change, new neurological signs. Urgent assessment. Unintentional weight loss, fevers, night sweats. Don't wait. Tests are powerful when timed right and aimed well. Quick stories to keep it real. Ellen, 79. Comfortable walker, no falls. DXA showed osteopenia. She was cued for medication. She asked for a risk talk first. FRAX score low, balance strong, vitamin D low. She fixed vitamin D, added protein and strength plus balance. 18 months, no fractures, better gait and a stronger back. The treatment was training, not a pill. Victor, 74. Misplacing names, worried about dementia. His doc ordered MRI first. He paused and asked for a stepwise plan. History, cognitive screen, B12, thyroid, sleep study. Sleep apnea showed up. Treatment improved memory and mood. No MRI needed. The fix was oxygen at night, not a magnet. Rita, 78. No symptoms, marketed a VIP full body scan. She said no. Stayed with evidence-based screening, walked daily, worked her BP down 10 points, and spent that scan money on better shoes and a gym buddy. That is prevention. The 5 to question after 70. 1. Reflex drug-driven DXA pathways. Scan and discuss risk, but don't jump to meds without a fall risk and lifestyle plan. 2. MRI for mild memory slips without red flags. Start with history, screen, and reversible causes. Image when findings will change action. 3. Cardiac stress tests in the asymptomatic. Great for real angina, not for phishing. Control risk. Test when symptoms call the play. 4. Routine colonoscopy beyond the window. Individualize 76 to 85. Consider stool tests first. Generally stop beyond 85. 5. Whole body screening CT/MRI. No proven benefit for the well. High chance of cascades and harm. You're not anti-medicine. You're pro-wisdom. Less fear, more clarity. Fewer cascades, more life. Final word. This is educational, not medical advice. Partner with your clinician to tailor choices to your health, history, and goals. Comment, subscribe, share for ReInspired. Up next, 6 red flags of dementia. Most people miss these.
I hope this video brought you value and re-inspired you. If so, please subscribe, hit like, and leave a comment. And if anybody you know could use a little re-inspiration, please send it to them. Thank you so much for watching.